I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and a question I get all the time is having an aunt or an uncle with cancer considered a high-risk family history? This is a made-up example based on real patients I've seen. This is a patient who was diagnosed with ductal carcinoma in situ, or stage 0 breast cancer, as denoted by all these little white dots or calcifications on this mammogram. She was diagnosed at the age of 38 because she decided to start her screening earlier than the age of 40 because her aunt had been diagnosed with breast cancer at 48. She went and discussed this with her primary care doctor, who did order the mammogram. And because this patient falls in a high-risk category and has greater than 20% lifetime risk of developing breast cancer, her insurance did approve and paid for the screening mammogram early. And her first mammogram caught that she had calcifications. This is her second mammogram, a diagnostic mammogram in which they did a zoomed-in view and saw that she really had a lot of calcifications throughout her breast. So to answer that question, if you do have an aunt who has been diagnosed with breast cancer, if they've been diagnosed under the age of 50, that does count as a high-risk family history. If they've been diagnosed over the age of 50, but they've been diagnosed with lobular breast cancer, and you also have a family history of stomach cancer, or if they've been diagnosed with a triple-negative breast cancer or breast cancer in both of their breasts or two different breast cancers in the same breast, all of that does also count as a high-risk family history. If you have an uncle who has been diagnosed with breast cancer at any age, that also constitutes a high-risk family history, and you should see a high-risk breast clinic to figure out if you should start doing screening mammograms earlier as well. One thing is for certain, if this patient who was diagnosed with high-grade ductal carcinoma in situ, a 7-centimeter span at the age of 38, had waited until she was 40 to start her screening mammograms, she would have had a much harder time having her cancer treated and cured.